For the last 25 years, Canada has been swept up in a worldwide asthma epidemic. Today, asthma affects about 12% of children and 6% of adults in this country. Call it about 3 million of us altogether. The adult onset cases, an estimated 10 to 15%, are caused or aggravated by the many sensitizing agents or irritants that may be present on the job. That means roughly up to 200,000 Canadians have developed some form of work-related asthma in Ontario. The number of occupational asthma claims has tripled over the last decade. It is also one of the most common diseases that go through the Workplace Safety and Insurance Board. Occupational asthma, or work-related asthma, is asthma that happens for the first time because of an exposure to some kind of agent at the workplace. It is important to note that people who have asthma before may also have symptoms that get worse because of something at work. What exactly is asthma? Asthma is when your small airways narrow and make it hard to breathe. This means that the airways have become smaller, but can return to normal either on their own or with the use of some medications. Some symptoms include cough, chest tightness, difficulty breathing, wheezing, and with occupational asthma, there may also be nasal irritation. A worker suffering from occupational asthma presents all the symptoms commonly associated with the other, more familiar forms of the disease. Certain dusts, vapors, fumes, or gases in some workplace environments can irritate and inflame workers' airways.
Asthma can present in two ways in response to workplace exposures. The first is the most common, and that is an allergic type of response, where over a period of time a worker becomes sensitive to the exposures and there's development of inflammation and irritation of the airways. The other type of response is one which occurs to a high concentration of a chemical. Symptoms occur immediately and symptoms can persist over a period of time.
The treatment of work-related asthma starts with the control of workplace exposures that have caused or keep making asthma worse. Long-term medical treatment of occupational asthma may not be needed if the workplace exposures are controlled. Sometimes occupational asthma does not go away even after the exposures are removed. If this is the case, medical treatment is the same as that for any other asthma. Drugs that you breathe in, like puffers, are common treatment for asthma. There are different types of these drugs, including ones that decrease inflammation and ones for quick and sometimes emergency use. Occupational asthma is not confined to the chemical plant, the factory floor, or even the schoolroom. Nail cosmetics includes the application of nail polish, artificial nails, nail elongators, and/or nail treatments that are usually dictated by current fashion trends. Cosmetologists are being put at risk of increased and prolonged exposure to various hazards in the workplace. Many products are used during manicures and pedicures. Depending on the nail treatment being performed, exposure and health risks will vary amongst cosmetologists. It is therefore important that all workers are aware of the hazards. Nail polish consists of pigments suspended in a solvent to which hardening agents have been added. Solvents are used to dilute and hold other substances in liquid form. Professional nail enamel application includes 3 layers of polish, a base coat, a pigmented enamel, and a top coat. After each layer, several minutes are required for drying and hardening of the coat in which the solvents volatilize, meaning it goes from a liquid to a gas. Nail polish may contain formaldehyde and some methacrylates, which can cause occupational asthma with repeated inhalation exposure. In addition, repeated skin contact can lead to sensitization, where subsequent exposures will lead to an allergic reaction, such as eczema, skin rashes, and hives. Other chemicals, such as xylene, methacrylates, toluene, acetates, and ketones can be skin irritants if proper skin protection is not worn. Skin irritation can include itchiness, swelling, and/or burning sensation. Nail polish removers are strong solvents which are highly volatile. Exposure to organic solvents can cause many problems: nose, throat, lung, skin, and eye irritation, headaches, lightheadedness, nausea, increased pulse rate, and confusion. The degree to which each symptom is felt is related to the concentration of the solvent in the air. Some solvents in nail polish and nail polish removers may also be absorbed through the skin. This will increase the worker's overall exposure to a chemical. The application process for artificial and sculptured nails can take anywhere from a half an hour to 2 hours. An acrylic glue is typically used to attach the artificial piece to the nail. Originally, methyl methacrylate was used, but it has been removed from products because of its potential for sensitizing. A similar chemical, ethyl methacrylate, and other related methacrylates have now replaced it. Some of the solvents and chemicals used in nail salons are suspected reproductive toxins. It is important that exposure levels are minimized through proper ventilation to reduce the risk. Nail treatment sometimes calls for the buffing or sculpting of real or artificial nails using a pumice stone or a nail file. This process creates nuisance dusts that may be irritating when breathed in. Dust masks should be used to reduce the inhalation of dust. They, however, do not reduce the exposure to solvents and vapors. Safety glasses should also be worn. For more information, contact your local occupational health clinic for Ontario workers or check out their website at www.ohcow.on.ca. Or for Southwestern Ontario, call 1-800-565-3185.